Go.
My name is Amy Ramos. I have Jessica Castillo here that will be my patient for today. Today we will be doing a general medical examination that will consist of blood pressure, pulse, respiration, ear exam, throat exam, hearing test, which is the ear exam, and our lymph nodes. So first we're going to start by taking our blood pressure. I would like to go on the left side because it's closest to the arm. I'm going to make sure to lift his shirt up. We will want to use a blood pressure cuff that takes about 80% of his arm. I will be wrapping it around midways of his upper arm. I will locate his brachial artery, which is medial aspect of the bicep tendon. So I will, on the blood pressure cuff, we have this arrow that points to the brachial artery. So I will make sure to locate that first. So I will come medially. I will palpate the tendon. Go ahead and relax your arm. And I will place my arrow right around that area there. So up above here, we have measurements. These numbers are all even numbers. They will dictate our systolic and our diastolic numbers. Our systolic is the first number up top and our diastolic is the second number at the bottom. The first number represents at how hard our heart is pumping out blood, and this diastolic represents the resting of our heart. I don't want both of these cords to be touching. I want his palm up, and I want both of his legs relaxed, not crossing. Next, I will get my stethoscope ready. We want to make sure that both the earbuds are facing inward so we can hear the proper sounds. We want to make sure prior to starting our blood pressure, we want to make sure that our head is functioning properly. If you palpate, you will hear a sound in your earbuds. If the head is not on properly, we can rotate it and make sure that it is working. Secondly, I will be placing this just below my blood pressure cuff, up on the brachial artery. I will never ever use my thumb because our thumb contains our own pulse. Secondly, I will make sure that the knob of my blood pressure cuff is turned to the right hand side in order for the air not to come out and to get a proper reading. Secondly, we have our little, I'm going to call this our arrow, which is going to dictate our carotid sounds. So I will bring this up to about 180 millimeters of mercury. Then I will slowly, using my knob, turn to the left-hand side and I will be bringing it down. As soon as I begin to hear my first carotid sound, that will dictate my systolic number. As you can see, it began at 110. And it stopped at 70, which is going to be my diastolic number. So my systolic number was 102 and my diastolic number was 70, which shows that is with the normal range. Our normal ranges are between 120 over 80. Next, we will be testing his respiration. And when testing respiration, this is gonna, our patients are gonna be breathing out, and this is where you can see that the chest is rising. Thank you, I'm gonna be bringing down your sleeve now. So, the way that I'm gonna be checking respiration is by me placing my arm over his lateral aspect of his upper arm. I'm gonna tell the patient, I'm gonna be checking your pulse rate. Because if I tell them that I'm checking their respirations, it will alter the respirations and it'll change their breathing. So therefore, my patient didn't hear me say this. So I'm going to place my arm and I'm going to pretend that I'm checking his pulse rate, but I'm going to actually be checking his respiration for 30 seconds. Once I get my number, I will multiply that by 2, which will give me my actual number. My number will be anywhere from 12 to 20 respirations. So I'm going to give it a trial. I'm going to place my arm here. I'm going to be taking your pulse rate now, Jessie, and I will begin. Okay, that concludes my 30 seconds. I got a respiration of 8, so if I multiply that by 2, it'll give me 16. Secondly, we're going to be checking his pulse rate. I'm going to come, for me to check his pulse rate, I'm going to come to the lower arm of his, I'm going to come down to his forearm. I'm going to use 2 to 3 fingers. Again, we're not going to be using our thumb because it has its own pulse, so we don't want to use that. I will come over the radial artery, and I'm going to press firmly enough until I begin to feel a pulse. I will begin a 30-second time clock, and once I finish, I will multiply that, and it'll give me my pulse rate. So that concludes my 30 seconds. So I got a measurement of 24. So therefore, if I multiply that by 2, it will give me a measurement of 48, meaning that it's within normal range. Normal range is between 60 and 100 beats per minute. Oftentimes, in patients that are very active, like Mr. Jesse, we will see a pulse rate of 40 beats per minute. He was at 48, which tells me that he's probably very active. Next, we're going to move on to the ear exam. In order for me to pursue my ear exam, I'm going to be using this instrument called an otoscope. What I will be doing is I will be coming out to his external ear, and I'm going to be pulling up, which is our helix, and out in order for me to get a better visual of the tympanic membrane. I'm going to come in, and what I'm looking for is a grayish translucent looking of the tympanic membrane. No growth like lesions. We don't want any redness of the tympanic membrane, no pus, and no other deformities in there. Secondly,